County Community College students. We're back. We're still working on discussing the heart, but today we're going to talk about the structure of blood vessels. So today we're going to be looking at arteries and veins, capillaries, venules, arterioles. All right, that's what we're going to be looking at today. So let's start with the structure of blood vessels, what they're made of, okay? So we have the tunica adventitia or the tunica externa. This is the outermost coat of, or the outermost layer of the blood vessel, the artery, the vein, for now, artery and vein for now. So this is Latin for coat that comes first. So you can refer to it as tunica adventitia, or you can refer to it as tunica externa. Externa will tell you that that is the outermost coat because it's external, right? Tunic or tunica means coat. You've seen in other cultures, men wear these long kind of gowns. It's a tunic. Back in the 70s, a lot of people were wearing tunics. They were real cool with like Nehru collars. I don't know if you know about all that. But anyway, tunic is a coat. And this one is the outermost coat or outermost layer, the externa, the coat that comes first. That's what that's Latin for. It's a strong, fibrous connective tissue. I'm going to abbreviate connective tissue by CT throughout this lecture. And it keeps the vessels open and it prevents tearing during movement. So this fibrous, strong, flexible coat, it actually, I shouldn't say flexible, but I should say a strong and fibrous connective tissue, outer layer of the blood vessel allows for, during movement, it's so strong that it won't tear the blood vessel. Like you don't want to be playing basketball, for example, and you go this way and you come back and you switch directions. You don't want your blood vessels tearing. So this tunica adventitia or tunica externa prevents that. It keeps the vessels open and prevents them from tearing during movement. Let's look at tunica media. Media means middle coat. This is Latin for middle coat. This is the middle layer, right? The tunica media is the layer of smooth muscle with that C with a little line over it. I forgot to tell you that. A C with the line over it is with, an S with the line over it is without, and a P with the line over it is after. That's just some medical shorthand. So let's look at the tunica media, this middle coat. This is a layer of smooth muscle with a layer of connective tissue. Smooth muscle, let's remember that. Media, middle layer has muscle. So all these M's, middle or media layer has muscle, smooth muscle, with a layer of connective tissue. The big deal with the tunica media layer is that it allows for vasoconstriction. Things to the vaso means vessel, constrict means to get smaller. Vessel will constrict. And vasodilation, vessel will get bigger, right? So the smooth muscle in this tunica media is innervated by autonomic nerves, parasympathetic and sympathetic nervous system, which we'll talk about in a little bit. And it's supplied with blood by the tiny vasa vasorum. That just means vessels of vessels. So that's not really something that I'm not interested in you really knowing. The main thing I want you to know is that the middle layer allows for vasoconstriction. So the muscle is in the, just say artery, we'll say artery, or in the vessel, can get smaller or vasodilate and get bigger. So For example, if you are hot, like it is now, very warm, your arteries, we'll just say arteries, are vasodilated. Why are they vasodilated? To let heat escape. And this layer is allowing that. Let the blood flow a lot easier and let the heat from the blood escape. When you're cold, like it'll be this winter, the vessels will vasoconstrict. They'll get real tight. And that is to conserve heat, to keep the heat in so that your body will stay warm and your blood will stay warm. All right? So this layer the tunica media layer, can vasoconstrict and vasodilate due to the muscle, the smooth muscle that's in that layer. Tunica intima, now you can see the word intima, like intimate, means it's a closeness there. So this is the innermost layer, innermost coat. That's Latin for innermost coat. Tunica intima is the innermost layer. This is made up of endothelium that is continuous with the endothelium of the heart itself. This endothelium is a really flat endothelium known as simple squamous. I think you remember learning about simple squamous in 240. Let's just put a basement layer here and let's just draw some really flat simple squamous. Nothing much going on with simple squamous. Now I'll put a little nucleus in each one. This is the endothelium here of a simple squamous. Really flat and allows blood to flow through very easily. Let me kind of give you an idea of how this looks. So you have the, let's just draw the outermost layer like this, right? We'll say that is the what? The outermost layer. Tunica adventitia, also known as tunica externa, right? Then, wish I had, oh, let me just get some. Then we'll draw the next layer, and that will be what? What's the middle layer called? Has the word, it has a letter M, and that is because it's middle and it also has muscle. So the M for middle, muscle. And that will be the green one, right? This is a blood vessel. We'll say this is an artery. It could be a vein, but we'll say it's an artery. So you have the blue is the tunica externa or tunica adventitia. Now you have the green layer that is the tunica media. And then let's have this layer is the tunica intima. This orange layer is the tunica intima. Can you see the three layers here? Tunica intima. Why is it intimate? Because look what's going through it. The tunica intima, the orange layer, is intimate with the red blood cells coming through. Okay? Red blood cells are intimate with the orange layer, hence the word innermost coat. Tunica intima. Green layer has the muscle in it, vasodilation, vasoconstriction. And then this tough, kind of fibrous layer on the outside, that blue layer is tunica adventitia, tunica externa. So that will be, those are the layers and the structure of arteries and veins. I want you to know though that the arteries are a lot thicker than the veins, a lot thicker than the veins, especially where the tunica media is concerned, a lot thicker. Let's look at, going to talk about blood vessels. We know that the arteries takes blood away from the heart, because we will remember A for A-way, artery away. Small arteries are known as arterioles. Veins takes blood towards the heart. Veins takes blood towards the heart. Small veins are known as venules. Capillaries are connectors between arteries and veins. So they actually are although they're small capillaries, they have a very important job, because capillaries, this is where they are the site of all material exchange, right? Nutrients, gases, etc., through the capillaries. The prime function of blood is to transport essential materials to and from the cells. That is what these vessels are supposed to do. Transport blood to and from the cells. The delivery and collection takes place in these capillaries. So capillaries are very important. I want you to know that arteries and veins are macroscopic. You can see those with the naked eye. So I'll just put macro. So they're large. Macro means large. Macroscopic. Arteries and veins are macroscopic. Capillaries, on the other hand, are very small. Cannot see them with the naked eye. And they are microscopic. Okay? So this is the order it goes in here. Arteries, arterioles, to capillaries, to venules, to veins. And then it starts over, and it's just a continuous cycle. Right? Veins. Yeah, so we'll just keep it going like that. That's what circulation is. Circulation's main function is to keep the capillaries supplied with enough blood to meet the changing needs of the cells. You want to keep those capillaries supplied with enough blood to meet the changing needs of the cells. What do we really mean by that? Well, if say, for example, you're running, your cells need more oxygen. So what is going to happen to the tunica media? It's going to vasodilate so the blood can go through a lot easier and get blood to the different tissues quicker, especially the tissues in the legs and the arms, and of course the heart. So the heart will keep pumping and getting the blood going around so that you can run. If you're just chilling, relaxing, because today is so hot, you just want to sit down somewhere, you don't need the blood pumping as much. These would be the changing needs of the cells. You're not running, you're not excited about anything, you're just relaxing. So then the vessels don't have to be so vasodilated. They can actually get a little smaller, constrict a little bit, because you don't need that much blood being pumped at that time. All right? That's just so that you will remember this setup. Now, the thing is, another thing I wanted to mention about capillaries, and you'll see it in the text. I wanted to remind you that this section here, the blood vessels, I know that it is in chapter 29. I'm going to go back to chapter 28 and finish up chapter 28, but I wanted to hop into 29 because I needed to introduce the blood vessels. Then I'll go back into chapter 28 and discuss the conduction system of the heart. But I know the author wrote the book like that, but I don't want to teach it the way he wrote it. I like to go in a different order. So we were talking about the heart, then I need, of course, to talk about the blood vessels. I'll go back and talk about conduction. We'll go back into chapter 28 in the next lecture, perhaps. The rest of this is, I want you to remember about capillaries. Capillaries have holes in them to make exchange even easier. These holes are known as fenestrations. The word fenêtre is a French word. It means window. So it's like these openings, like a window, are in capillaries. And it really does permit the easy flow of fluids and solutes across the capillary wall. Capillaries really want to be able to have a thin wall so you can have an easy exchange of nutrients and gases, right? That's the main thing to remember about capillaries. Another thing, I also just only want you to remember arteries takes blood away from the heart and veins takes blood towards the heart. I don't want you talking anything about arteries are blue or veins are blue and arteries are red. I want you to get that out of your head. I don't want you talking anything about arteries only carry oxygenated blood and veins carry deoxygenated blood, because you know that isn't true. The two veins, superior vena cava, superior and inferior vena cava, do indeed carry deoxygenated blood. They're veins, that's true. But the pulmonary vein is a vein, and it carries the most oxygenated blood there is towards the heart. So veins are not just carrying deoxygenated blood. I need you to not think of that. Arteries are not just carrying oxygenated blood. Remember, the pulmonary artery is not carrying oxygenated blood. It's carrying deoxygenated blood towards the lungs to get oxygenated and come back through the pulmonary vein, right? And then on out of the aorta, which is carrying oxygenated blood. So I don't want you getting all mixed up about what's blue and what's red, what's oxygenated, what's deoxygenated, because that's all crap. I need you to remember arteries takes blood away from the heart and veins brings blood towards the heart. That is what I need you to remember about arteries and veins as far as any kind of direction. The other thing is here, I think I'm going to draw the aorta on the board, and then we will talk about the aorta, and we'll talk about some circulatory routes too. I'll come back and talk about the pulmonary circulatory route versus the systemic circulatory route. All right, so we're back, and we're going to go on and talk about the aorta now. We're still talking, of course, about vessels, blood vessels. The aorta is the largest artery in the body, right? We know that. So here we are here, aorta. Now, where does this vessel come out from? From what chamber in the heart does the aorta come from? You guys remember? And if I were to put, let's just put, let me just draw it down a little bit. Like this, okay? And I'm gonna put a valve here, right? What is the name of that valve on the aorta? This valve, this green valve, is the aortic semilunar valve. Where does this come out? Where is this in the heart? And what chamber? Correct. It's in the strong muscular chamber of the left ventricle. The left ventricle is responsible for pumping all the oxygenated blood through this aortic semilunar valve into the aorta, into all the tissues of the body. Please remember that. So here we are. I'm just gonna, I'm gonna leave it at that. I'm not gonna complicate this. So let us go on and look at the blood is being pumped up from the left ventricle into the ascending aorta, because the blood is ascending, going up. It's coming on around this aortic arch here. The blood will then stop off into the first branch of the aortic arch. The first branch of the aortic arch is the brachiocephalic. That's branch one. Here's the word brachiocephalic, and here it is here. The brachiocephalic trunk is, all of these are arteries. So I don't have to say brachiocephalic artery. They're all arteries because they're all coming off of the aorta, which is the largest artery. So the first branch off the aortic arch is the brachiocephalic. Now that's going to bifurcate into two other branches. I need you to know that the brachiocephalic trunk bifurcates off into the right subclavian artery, of course it's an artery because it's coming off the aorta, and the right common carotid. So the brachiocephalic trunk bifurcates and takes care of the right side of the head and neck of the body. The right subclavian is going to take care of this aspect, sub meaning below, clavicle, below the collarbone, subclavian artery is going this way. Right common carotid is going up this way into the brain. The common carotids feed the brain. Second branch off of this aortic arch, here's the second branch, it's going to be the left common carotid artery. We have to give blood to the left side of the brain. Then the third branch off of the aortic arch, is the left subclavian artery. I need you to understand that the brachiocephalic branch here, or trunk here, the brachiocephalic trunk, will bifurcate and take care of the right side of the head and neck area. So you have a brachiocephalic trunk, it's going to bifurcate, go up to the right side of the head become the right common carotid, and then this way to the right subclavian. The second branch off the aortic arch is going to be the left common carotid. The left common carotid is going to feed the left side of the head with oxygen, and then the third branch off is going to be the left subclavian. The brachiocephalic takes care of the right. The left are two separate branches off of the aortic arch. So remember that. Brachiocephalic is the first branch off the aortic arch. It bifurcates to feed the subclavian, become the subclavian artery and the right common carotid. Second branch is the left common carotid artery. And then the third branch is the left subclavian artery. Coming on down, now you see the blood is descending, so you're in the descending part of the aorta. Coming down to the chest area, you're in the thoracic part of the aorta. The aorta, please note, it does go through the diaphragm. So the diaphragm, where is a sheath of muscle that we use to breathe, it has holes in it because we got stuff going through it. And it comes on down through this diaphragm into the belly, and that's the abdominal aorta. So the aorta has an ascending part, an aortic arch, a descending part, a thoracic aorta, and an abdominal aorta. From there, the aorta bifurcates here, and it goes down to the toes. It's going down to the right leg through the common iliac artery, and the left leg as the left common iliac artery. So you have the right common iliac artery and the left common iliac artery. This is something you will have to remember. You'll have to remember that there are ascending, an aortic arch, descending, thoracic, abdominal, and then of course the common iliacs on the left and right sides of the body. A while ago there was a football player, it's a long time ago actually. Some people broke into his house, and I think his name was Sean Taylor, if I recall. And I remember listening on the radio as I was driving into work. The family was like, please pray for him, pray for him. He got shot in the leg. And I'm thinking, got shot in the leg, big football player, so what? Little did I know he was shot in the femoral artery, which this ends up becoming. That is a pretty big artery. And as the heart pumps, and with arteries, it shoots blood out every time the heart pumps. So he was losing a lot of blood. Had his girlfriend not been hysterical, because there was a baby involved in the house, and these people broke in and they were shooting, and there was a lot of chaos. And of course, she's concerned about the baby. She's concerned about her own life and his, and you're awakened in the middle of the night with some knuckleheads breaking into your home and shooting, then you're disoriented. But if anytime you see somebody that's like bleeding out, and I know blood is biohazardous now, but for goodness sake, just try to add pressure. Get your coat, some towels. If you could just put your hand down on it and put as much pressure on it as you can so that it can stop gushing out and somehow form a clot or at least slow the bleeding, right? But little did I know that he was shot in the femoral artery. He did pass away, and I always remember that. I was like, oh, I won't take that for granted anymore about where someone is wounded. It was a mortal wound, right? All right, let's look at circulatory routes here. Circulatory routes. So I need you to understand that blood flow is a circuit. It's a circular pattern. So you have the pulmonary blood flow, or the pulmonary circulatory route. This is blood is pumped from the right side of the heart to the gas exchange tissues of the lungs. So from the pulmonary circulatory route, blood is pumped from the right side of the heart to the gas exchange tissues of the lungs. On the systemic circulatory route, blood is pumped from the left side of the heart to all the tissues of the body. Let's see if we can, see if this is true, if these are true statements. So I'm just going to squeeze in a little heart right here. Let's just squeeze in a heart right here. So orient yourself. You know that this is the right side of the heart, and you know that this is the left side of the heart. You will remember that this is the superior vena cava, where blood is coming, draining the upper aspect of the head and neck. And this is the inferior vena cava, where blood is draining the lower aspect of the body. All going into the right atrium. And as the blood comes through from the right atrium, it goes, of course, through this valve that's open here, and that's known as the tricuspid valve, into the right ventricle. Now, we're on the right side, right? And pulmonary circulatory route, blood is pumped from the right side of the heart to the gas exchange tissue of the lungs. So from this area, the right ventricle, where does the blood go? I'm going to push it right here to where it says it goes. It's going to leave the right ventricle and go into the lungs through, of course, the pulmonary semilunar valve through the pulmonary artery. So the pulmonary circulatory route is correct. It leaves the right side of the heart and it goes to the gas exchange tissues of the lungs. Let's look at the systemic circulatory route. Blood is pumped from the left side of the heart to all the tissues of the body. Now back from the lungs, blood is going to come in through the pulmonary veins into the left atrium, on down here through the mitral valve, also known as the bicuspid, correct? Into this powerful left ventricle that's responsible for pumping blood to the systemic system. So, is this true? Blood is pumped from the left side of the heart to all the tissues of the body? Yes, it's going to go into the aorta, and it goes from the left ventricle to all the tissues of the body. So these things have been proven here, and we understand the circulatory routes of the pulmonary circulatory route and the systemic circulatory route. Before I leave here, I wanted to go over a word here called anastomosis. Anastomosis. Anastomosis provides detours for blood to travel in case a route or route becomes obstructed. When there's an obstruction, say a blood clot, blood will find another way to flow. So it's just like if you are in a traffic jam due to road construction, oftentimes they'll have a detour. Hey, you can exit here, follow all these signs, and you'll go around a different way. So for example, so an anastomosis is a detour for blood to travel in a different route. One that comes to mind that I need you to be familiar with is the circle of Willis. This vascular system is at the base of our brain, and it provides a great series of anastomoses. In other words, the brain is that dependent upon blood that it has many routes or routes to go to get blood to it. If one is blocked, then it'll go another way. And that's what anastomosis is. And I need you to know that the circle of Willis is a very good example of an anastomosis. I remember when Bill Clinton had open heart surgery, they looked in his heart. He actually did not have, they quote, I'll put this in quotes, they say he did not have a heart attack because no tissue was damaged, none of his myocardium was damaged, but he had felt severe pain in the heart. And I think he had just come from a run or something. So he was in pretty good shape, except he ate a lot of kind of southern food with a lot of heavy gravies and fried and oils and stuff, and it did a job on his heart. He had like 3 blockages, if I recall. But he had exercised so much that he had little tributaries that were going around those blockages. And it was just enough to feed his heart muscle where he did not sustain an infarction or a lack of blood. He had less blood, but it wasn't a total lack of blood. So you can have an obstruction, which like a blood clot, that will cause ischemia, which is where the tissue will be deprived of oxygen and nutrients, and that can cause an MI or myocardial infarction, right? Ischemia is the lack of nutrients. The infarction is the actual damage that's done to the heart muscle. The fortunate thing about Bill Clinton is he had a lot of anastomoses. Even though they weren't like big and large as an artery, they were enough tributaries, enough to keep the tissues nourished. So anastomosis, but the one I want you to make sure you look at will be the circle of Willis, which is at the base of our brain. Trying to see. Now the next thing I want to talk about will be fetal circulation. Fetal circulation. So turn to fetal circulation in your text so that we could go through this together. Okay, now let's take a look at fetal circulation. We're still in chapter 29, and this is pretty much going to wrap up chapter 29. So after we get through fetal circulation, that should be pretty much the contents that I'm interested in you focusing on. But let's look at it. I need you to remember this is a fetus, so it's not a baby, and it's still in the mom, and it's still developing. So who takes care of all the breathing and the eating and digestion? Yes, the mom. So the fetus does not need to worry about breathing. The fetus does not need to worry about eating, because whatever that mom eats, that baby is going to get. That fetus is going to get, excuse me. If that mom doesn't eat, that fetus is still going to get nutrients because it will take it from the mother's whatever, her bones, her teeth, it's going to get his. So you don't have to worry about it. So it's better if the mom is well nourished and eating and drinking sufficient fluids, water specifically, and breathing. But the fetus does not need to breathe as long as the mom is breathing. The fetus does not need to eat as long as the mom is eating. Right. So keep that in mind. This is a fetus. So fetal blood secures oxygen and food from maternal blood instead of from fetal lungs and digestive organs. Do you see here is that the fetal blood can get oxygen and nourishment from the mother's blood. They don't exchange blood. It's just getting the oxygen and the nourishment from the mother's blood, from the maternal blood. instead of from the fetal lungs, because of course the lungs are not developed and the fetus does not need to breathe, and the digestive organs are not developed and the fetus does not need to eat yet. All right, so let's look at the umbilical artery. We'll start with that. This is the connection, the umbilicus, right? When you see the umbilicus on in the fetus, the umbilical cord is connected, of course, to the placenta. When the fetus is being developed or developing, it makes its side of the placenta, and the mom, the maternal side, makes her side of the placenta. Now, the umbilical artery's job is to take blood away. It's an artery. So what do arteries do? They take blood away from the heart. So the umbilical artery takes blood away from the fetal heart. But I need you to know that this blood is deoxygenated. So it's taking blood away from the fetal heart. And where is it taking this blood to? Yes, this badass organ called the placenta. So the umbilical artery takes the blood to the placenta. The placenta is the baddest organ that you can ever think of. I know we got a brain, we got kidneys, but this placenta is badass. So it goes through an exchange here in the placenta. It's like I said, the mom makes her side, the fetus makes its side, and then the blood goes through to the umbilical veins. Now the umbilical veins have the most oxygen in them, and it carries oxygenated blood, which is about 80% saturated. This blood is heavily laden with oxygen coming from the umbilical vein. And this saturated blood, oxygenated blood, is carrying this blood straight to the fetus. It got the exchange through the placenta. Remember, the mom's doing her part, so she's giving the placenta the oxygen, and so then it goes to through to the umbilical vein to the fetus. This umbilical vein wants to bypass the liver. Why would you want to take all this great oxygenated blood and take it to the liver? You don't. The fetus is not using the liver. It's not using anything in the digestive system. So skip the liver, and it continues on as the ductus venosus. And you can see the word vein in here. So you know it's coming from an umbilical vein, skipping the liver and going through another kind of vein called the ductus venosus. Now, a duct is an opening or passageway, and venosus is the vein, the name of it. The ductus venosus bypasses the liver. Like I said, we don't want all this great oxygenated blood going to the liver. We got other tissues of the body to feed in the fetus. Then it goes into the inferior vena cava. This is great, rich, oxygenated blood pouring in or dumping into the inferior vena cava here, inferior vena cava, into the heart in something called the foramen ovale or foramen ovale. Now the interesting thing about the foramen ovale, it is an opening between the septum, and remember we talked about what a septum is. A septum is a wall. This is an opening between the wall, between the septum, between the right and left atria. So there's this oval-shaped opening. That's what a foramen is, an opening. And you see it's oval-shaped, ovale, or ovale. This is to bypass the fetal lungs, right? We don't need to give oxygen to the lungs because the fetus is not breathing. So we need to bypass the lungs. We need to bypass the liver because the fetus is not eating, and a liver plays a huge role in digestion. And we don't need to send oxygenated blood there. We need to get this great oxygenated blood coming from the umbilical vein to all the other tissues of the body. From the foramen ovale or ovale to the ductus arteriosus. There's a duct, another kind of passageway or tube, and you see that's where it has artery in it, right? Arteriosus. This ductus arteriosus is a small vessel that connects the pulmonary artery with the descending thoracic aorta. So there's a little opening. The ductus arteriosus is a little opening, a little duct, I should say, that connects the thoracic aorta, and the pulmonary artery. It's to bypass the lungs again. This is another detour to bypass the lungs. Let's take a look at that. These are the ones I really want you to remember. I want you to remember ductus venosus, because anytime you see something with a vein, I want you to think of the liver. I want you to remember foramen ovale or foramen ovale, whichever way you want to remember it. That's an opening that's oval shaped. And I want you to remember ductus arteriosus. So this is an artery that's connected between the pulmonary artery and the thoracic aorta. So let's just see if we can take a look at this little fetal heart. And let me see if I can get something going here. We got a pulmonary artery coming here, and we got the aorta coming over here. And then you know it like that. Okay. And what do we have? Oh, inferior vena cava coming up like this, coming in here. So we got the oxygenated blood coming from the placenta now, going into the umbilical vein, carrying this rich oxygenated blood into the fetus, bypassing the liver. So whenever you think of a vein or venous system, think of a liver, okay? And with the veins. So the ductus venosus is going to bypass the liver. I'm going to just put a liver here. Just say this is the liver. And instead of going into the liver, we're going to bypass it. I'm just going to go kind of through it and end up in the inferior vena cava here. Inferior vena cava going into the right atrium. Now, foramen ovale, that is here between the two atria, an oval-shaped opening, because we don't need blood going from the right atrium into the right ventricle, going over into the pulmonary artery, all this stuff is doing. No, we need this blood to get over here as quickly as possible, going through this foramen ovale into the left atrium, because we need it to get into the left ventricle to pump to all the tissues of the body, right? But since this is such a high pressure system, some blood will trickle down into the right ventricle, and sometimes it will go into the pulmonary artery, but we don't need blood going into the pulmonary artery. So there's a connection between the pulmonary artery and, I'm just going to draw a connection, and the thoracic aorta, like this, so that any blood that does come down here into the right ventricle, going into the pulmonary artery, it will be transferred here and not go to the lungs. Maybe a little bit of go to the lungs, but just enough to keep the lungs viable. Not enough to be transferring any type of oxygen to the lungs, because the fetus is not breathing. So here's that ductus arteriosus coming from the pulmonary artery and the thoracic aorta, so that oxygenated blood can then go to all the tissues of the body. It's coming straight from the inferior vena cava, oxygenated blood, going straight over into the left side of the heart, coming on into the, coming down here, of course, into the aorta, and here, from the left to the left ventricle, coming on down like this. But sometimes some blood does come down through the tricuspid valve and goes to the pulmonary artery, and when that does happen, there's a fail-safe here that says, hey, stop going to the lungs. This blood will go into the aorta. It's a high-pressure system, so of course some blood may trickle down into this area, but we don't really need blood in the right ventricle going to the lungs, because we need to bypass the lungs. So I need you to remember that the foramen ovale will bypass the fetal lungs, and as well as the ductus arteriosus will bypass the lungs, right? All right, so usually when you see the umbilical artery, there should be two of them and one umbilical vein. So it kind of looks like this. Say that you cut, so this is the umbilicus here, and you know, it's attached to the placenta, it's attached to the baby. So you're gonna cut that, or the doctor will cut it. So it just sticks out like a little stub. So we're gonna look at this cross section. We'll look at these two arteries here and the vein here. These two arteries and this one vein, right? Pediatricians should always check that, especially if they're suspecting any kind of problem. Because if there's one artery and one vein, generally that means there's some kind of midline structure that has been not developed properly. So that pediatrician's job will be to really check midline structures. Because when we're born, like when we're developing embryologically, we're forming from lateral to medial. Everything is coming in like this. So sometimes you may look and maybe the heart didn't form properly. Something here in this midline section, you have to check the urogenital system, check the roof of the mouth for clefts, you know, just check this midline section very much. It could mean nothing, but you should have two arteries and one vein. But if you have one artery, one vein, that could be indicative of a midline structural problem. So that's all I want to say about that. I do want you to know, or at least be familiar with the terms of what we were when we were forming. Umbilical arteries become the umbilical ligaments. Everything kind of closes off and is no longer used. Umbilical vein becomes the round ligament of the liver. I want you to kind of relate venous system and veins with the liver. The ductus venosus becomes ligamentum venosum of the liver. I mean, that's what's in us now. This is when we're fetuses, and this is when we are adults. Foramen ovale or foramen ovale becomes the fossa ovalis, and it becomes a mere depression. So this foramen ovale here, this closes off. I'm just gonna show you. And now you're left here with a depression, so to speak, between the two atria, between the right atria and the left atria. That becomes a mere depression. It's no longer foramen ovale. As soon as the baby's now born, so it's an infant, as soon as it takes its first breath, it functionally closes after the baby's first breath. And this structurally closes in about 9 to 12 months, okay? Fully closes in about 9 to 12 months. Now, if it stays open, that's called an atrial septal defect. Atrial, that's not right. Atrial septal defect, or ASD. Usually we could fix those. You can live quite a while with no problem. About age 7, 8, we close those off. Nowadays they could do it, feed it up through ephemeral artery, or go up through the inferior vena cava and put a little mesh in there and it'll close off. And usually it's no problem. If this one is open though, between the two ventricles, that is going to be a ventricular septal defect, a VSD, and that one needs to be closed off pretty soon because the baby will show problems, with feeding, etc. And usually it'll be a little cyanotic, a little blue, and usually want to close that off within the first few months of life, depending on how big it is and how bad the baby is responding. This one, it could be an actual child. This one you want to do it during pretty much before, during infancy. The last one, ductus arteriosus, sounds kind of like Harry Potterish. Ductus arteriosus becomes the ligamentum arteriosum. This little doodad here that has coming from the pulmonary artery hooking up to the thoracic aorta, that red one, that goes away and becomes a hard cord or a ligament, because now we no longer need blood going into the aorta that way. We do need the blood coming from the pulmonary artery into the lungs, and it doesn't need to detour. It needs to go into the lungs for us to breathe properly. So that is pretty much it. I cover everything about fetal circulation. Make sure you're familiar with the ductus venosus. Anytime you see venosus or vein, think of liver, so this is going to bypass the liver. Make sure you remember the foramen ovale. Foramen ovale, that's a little oval-shaped window between the two atria that allows the blood coming from the inferior vena cava directly from into the right atrium. It shoots right over to the left atrium, down through the mitral valve or the bicuspid valve into the nice left ventricle to push the blood to all the parts of the body through the aorta, right? So you want to make sure that you bypass the lungs on that one. And the ductus arteriosus, another detour bypassing the lungs, because there's this connection. In case a little blood does come from the right atria into the right ventricle, that blood will go into the pulmonary artery for sure and end up back in the aorta through this ductus arteriosus. Okay, so that was chapter 29. The blood vessels and circulation. That's going to conclude chapter 29 for most of the information that I'm interested in you knowing. Of course, go through chapter 29 because it's a lot of arteries and veins. You should have received, or you should have received a handout in your email, I think, on arteries and veins. Those are the ones on the arteries and veins sheet or handout that I've given to you. Those are the ones I want you to know. But next time, in the next video, we're going back to chapter 28, and we're going to talk about the conduction of the heart, the electrical conduction of the heart. So that does it for this video.